Hello, this is bioethical presentation for the DMP 7000. This is scenario 2 from the DMP guidebook, and it's regarding end of life. Dr. B is a DMP clinical nurse specialist working in an urban healthcare center with multicultural population base. One of his roles is to discuss the families and patients regarding end of life. He has a patient named Miss C who has end-stage renal disease and is on the renal transplant floor. Dr. B knows this patient from previous admissions. The patient is a Middle Eastern that speaks little English. She has been told that she is not a candidate for a second renal transplant. Previous admissions, Mrs. C wishes were not to be resuscitated. This admission, the advance directive needs to be signed again. The son, also the POA, refuses to sign the advance directive per her previous wishes, stating she is confused and does not know what she wants. The next day, the patient worsened, required intubation. The son continued to refuse signing the advance directive, and patient continued to get aggressive medical treatment. Over the course of several days, patient's mental status worsened to comatose, then eventually minimal brain activity was determined, and she was finally removed from the ventilator. What happened here? Ethical concerns, autonomy, informed consent, cultural perspective. This was a complex ethical dilemma concerning for did beneficence override autonomy? Informed consent was lacking? First, let's talk about informed consent. There's a language barrier. There should have been an interpreter at the beginning explaining to the patient the outcomes, alternatives, treatment options, along with advance directive wishes. Next, autonomy. This was lacking also. It didn't follow the moral rules. Respect the patient's rights, decisions, and along with helping them. The first one is to tell the truth. The second one is respect the privacy. The third is protect confidential information. Fourth is obtain consent. The fifth, which I think is the most important, is to help the families and the patient make important decisions. So to answer the scenario questions, what should Dr. B have done when the family members refused to sign the advance directive from Mrs. C? Would an ethics committee have played a role in this scenario? I think a discussion with the son regarding why he does not want to sign it could reveal underlying information that can help him understand his mother's wishes. Ethics committee would definitely play a role here. What would you do in this scenario? I would have daily discussions with the son. This would be key, as he would have maybe been able to see or understand what was going on, make sure there's no lack of communication. I would probably have a palliative consult. Another question is, what ethical principles would you feel took precedence in this scenario? Dr. B was performing his duty deontological perspective. I think beneficence overrided autonomy. I think the provider is trying to prevent premature death due to the POA son not signing the advance directive. Lacking of non-maleficence. This was not the patient's wishes, so is it considered doing harm? Let's recap. This was a complex ethical scenario. Maybe you can answer some of these questions. To me, there was lack of autonomy, lack of informed consent, lack of cultural perspective, and lack of non-maleficence. In our readings this week, analysis of patients' rights regarding dementia and PEG tube insertion discusses this exact scenario where beneficence principle is to prevent premature death. However, patients' autonomy should not be overridden. Hope you enjoyed this presentation and hopefully you learned something. Thank you.